From this conference in Noblesville, students will take the ideas they share back to Timmy College chapters across the country. The impact, however, will be felt around the world.
I always say we have a hybrid mission. Our hybrid mission is to expand access to healthcare, both locally and internationally. And then the other part of that mission is to empower students and volunteers to tackle global health challenges firsthand. The core of our work is really focused around this concept of getting an interest group of students and allowing them to drive our programming. So they fundraise, they advocate, and they serve on behalf of Timmy and on behalf of the international partner organizations and the patients that we seek to serve.
Student brigades travel to the organizations they sponsor in countries like Ecuador and Guatemala, stay for a week at a time, and serve around 400 patients. But the mission continues 365 days a year.
The one thing that I really loved about Timmy is the sustainability and the ability for us to go to these clinics and provide sustainable care to these people. So every 2 or 3 months, there's another person down there to, check the blood pressure medication. Is it working? Is it not? Is it too much? Is it too little? So that's one thing I just love about Timmy.
When the brigades come down, which is about once every 2 to 2.5 months, I guide them through the clinic process. They provide the expertise, they provide the labor, and I provide everything else.
Timmy's staff live and work in the countries they serve year-round to build relationships, negotiate logistics such as transportation, and follow up on brigade diagnosis to make sure patients receive comprehensive care.
I spend 3 days of the week doing clinical work. 2 of those days are in Quetzaltenango, the town where I live, seeing patients at the Popu Clinic, and then 1 day a week out in one of the rural communities in which we work seeing patients. It is by far the most rewarding thing that I have ever done. And I can tell you countless stories of patients that we have successfully intervened.
Timmy's headquarters in Indianapolis works as an efficient nerve center for operations around the world. Here they organize travel for the brigades, monitor patient health, track supplies, organize volunteers, and advocate the cause.
What you're looking at here is part of our medicine supply warehouse. We have volunteers who oversee all of this. Each year we distribute about $1.5 to $1.7 million worth of medicine. We're going to do this all with a very small administrative budget that's under $300,000 and a staff structure that here in the office you have 4 full-time staff and 4 abroad. So I think what that says to me is that because we find real passionate, real energetic people, we're able to do a heck of a lot.
Yet with all its efficiency, Timmy is still a small organization. So it is the hope of those involved that the current work is a ripple that will spread across a lifetime, whether the students go on to do work at home or abroad.
We have an opportunity to help shape the long-term perspectives of students. And by getting them involved in this work, hopefully they're seeing what the real challenges are to a person who faces barriers to healthcare access, so that when they become medical professionals or when they go out into another career, they think back to that moment and say, I get this, and I'm going to be engaged in helping solve these problems for underserved communities.
You can transport yourself to a completely different place in the world, and you are able to relate to somebody in a way that you never could have imagined. We don't even speak the same language, and yet there is this connection, and I think that it's certainly an impact that's going to be very lasting in my life.